Yeah, good. Pop you down there. Oh. There we go. Oh. Move that out of the way. Don't need that anymore. It's starting to get cold. It is starting to get cold. Here in the UK anyway. Guys, I'm going to kick off today's live session, just moving the heater out of the way, with a chat on one of the things that confuses so many people, which is the symptoms that they experience when it comes to back pain and sciatica. It is, you know, I've got the symptoms of buttock pain going from here down my leg, and someone else, well, it's actually shooting down here and it kind of goes a little bit down to here, and someone else is that it's actually my big toe just here that really hurts, and actually I've got back pain and buttock pain, and now I've just got pain in my calf. You know, what's going on here, and do I need something different? And this is the biggest thing that stops a lot of people from getting better, because they think that because their back pain differs from someone else's, theirs is actually down here over the buttocks rather than at the lumbar spine, that it's different. And sometimes people will even say this and have these internal conflicts when they have the diagnosis. So they will say, I've got an L5-S1 disc bulge. They'll say that in passing. And then they'll say, well, I've got pain down here over the buttock, or my piriformis, or my hamstring is sore. Do I need something different for me? Literally on a video that's talking about the very diagnosis that they've got. And this is the big thing that confuses so many people around lower back injuries. And it's much better that we talk about lower back injuries rather than back pain, sciatica, buttock pain, and these kind of things, is because if we are focused on the injury, it doesn't matter about what the symptoms are. Now, of course, we must add in here that if you have the emergency symptoms of cauda equina, you have loss of bladder and bowel control, saddle anesthesia, back pain or sciatica symptoms that were brought on by a significant trauma, you need to go and get those checked out at your A&E, your hospital, right, with urgency. But the vast majority of you do not have cases that are emergency symptoms. It is this back injury that is being managed poorly over an extended period of time that is causing you a lot of pain. And so people too often get distracted going from pillar to post, thinking that they need something different for their symptoms. And I want to make something very clear, because this is really perhaps the root cause of why there's so much confusion around back pain and sciatica on the internet, is that a lot of the advice around back pain and sciatica is just that. It is advice to help your symptoms of back pain and sciatica. And unfortunately, when it comes to the lower back, you can do all of these quirky, funny, different positions and stretches and bend and twist and all of that kind of stuff to fix your quote-unquote back pain in 3.5 minutes on a Tuesday afternoon. Or you can do stuff to deal with the underlying problem, the injury. And too often these funny, peculiar positions that we get into, these little hacks to fix your sciatica in an inordinate amount, or an infinitesimally small amount of time, are just chasing symptoms. And so many people get stuck chasing symptoms like paralumbar muscle strain. It sounds very technical. Lower back muscle strain. My back is stiff. That's the level of analysis that we need, and we get caught up in the technical jargon thinking that we need something very specific for this paralumbar muscle strain as opposed to something else. What we're suggesting, perhaps, Kian, in this scenario, great to comment in on this, is that we're saying that we've got some kind of strain to the muscles, that is the primary problem. And if that is the case, I want to play out the case where actually a muscle strain might be the primary thing that's causing your low back pain. And it might well be that actually you've just done a personal best on your deadlift. You've done 221 kilos, 5 kilos above your previous max, and you failed, and you strained that lumbar erector spinae muscle because it couldn't deal with the deadlift. And you got profuse bruising all over the lower back, right? Because the muscle failed. But in the moment that that muscle failed, working at its maximum possible level, and it failed, and it got torn, and it's now bleeding, and there's a lot of bruising visible from the surface, a significant strain, all of the load went through the disc. So you better believe you've got some kind of injury to the lumbar spine alongside that muscle strain. And the muscle strain is going to heal relatively quickly. Why? Because the muscles have a very good blood supply. And so they will heal in a very, very short period of time. What you'll be left with is the herniated disc issue, is the spinal issue that's there in the background. Too often people presume that because you're feeling it in the muscles, that the muscles are strained, the muscles are tight, the muscles are this, that, the other. The muscles are not the problem. And if we focus on dealing with the injury at the root cause of the problem, then it's very, very simple. We create a protective environment to stop making the problem worse. We create practices and habits that stop making the problem worse. We have little relief strategies that ease strain on this area, which is accumulating every single day because, well, we have to live with our backs in spite of how bad they might or might not be. And to Matt's comment, yes, the human body is actually so amazing. It really is. It really can rebound from so many different things that you'd think were impossible. It is amazing. And then all we need to do to continue that recovery process is simple building a stability mechanism for the spine to protect it from further injury and load tolerance to strengthen it back up again. And then we can add on extra nuances like working on the hips from a mobility point of view for the long term, but this is really it. We don't need to make it more complicated. All those funny positions that you guys have to adopt, those are, and stretches and this, that, the other, that's playing around with symptoms. And that's making use of quirky positions to try and provide some element of relief. Just jumping into the comments here, you know, and this happens every single live stream, right? Every time we do the live Q&A. Look, I've got this symptom, I've got that symptom, focus on the injury, and the advice and the guidance is the same. And I wouldn't speak so confidently about this if we hadn't had literally thousands upon thousands of members, patients, etc. over the years that have every conceivable different diagnosis, different set of symptoms, different set of circumstances. Some have surgery, many have surgery, many haven't. Many have minor, many have significant disc herniations. Some have this, that, the other. But they do the same thing and they get results. Right? They rebuild from a principled point, rebuild the health of the lumbar spine, and they do well, rather than getting distracted with symptoms. And equally, you can get 10 people with exactly the same kind of MRI finding, and they could all have different symptoms, and some of them will have no symptoms in that moment, which is also an interesting thing. What's the best way to stretch my back post-spinal fusion surgery? I have it through most of my back, so I'm assuming that we've had most of the back fused. Well, you're not going to be stretching a fused segment. By definition, it's fused, so it's not going to stretch. And I would suggest that that's not what you want to be focusing on when we have a lower back injury, or sorry, when we have had a fusion. You need to focus really hard on actually creating that ability to stabilize the spine. Because while we might have had the fusion with the bolts and the nuts and the screws and the rods and all that kind of stuff into the lumbar spine, it's not a foregone conclusion that we have the muscular system that is capable, and the coordination, the skill, to actually stabilize that area of the lower back. So that is where we want to really be working hard at. And do you know what? That's no different for the person that hasn't had spinal fusion. The only difference is when you fail to control your spine, 3 out of these don't move and only 1 does. So all the movement goes through the one. Whereas when someone else has got a herniated disc, yeah, most of the movement might go through the injured segment, but the others will also dampen that a little bit. Something to think about there. It doesn't change. It doesn't change. You want to focus on stability work. Taste Lab Collective has said, thanks for the advice on the inversion table. I'm glad it was helpful. Guys, those of you that don't know, I do think inversion tables are really good, but you've got to be careful. Because if you buy one that doesn't have a good ankle locking mechanism, and you're having to bend down right after you've finished your inversion like that, look at my back. I don't want to do that after I've done an inversion table, right? I want to try and keep my spine as neutral as possible. And so we've got to bear that in mind. And so that's something to think about. Additionally, how you use the inversion table. A lot of the inversion tables are sold with people going upside down doing sit-ups, and that's all silliness. You don't need to be doing that. You need to focus on using them responsibly, and that tutorial is freely available. It's on the YouTube channel and on the website, and it'll really help you guys use those things as an asset. But remember, above all, if you're using inversion tables or doing any kind of stretching work for the spine specifically, decompression work for the spine, whether it's in a clinical environment like in the room that we have behind me or somewhere else, you have to make sure that you are pairing it with rehab. You must be doing strengthening work alongside that. What else have we got here? When I sit down and stretch my leg straight, I feel pain in my tailbone. What should I do? So when you stretch your leg straight, what is happening is that your hamstring attaches here, and the stiffness that you generate results in that happening, and that pulling forwards like that. And you see what's happening to the lumbar spine up here as we do this? It's starting to strain this area. You most likely have an injury to the lower lumbar spine, and when you do that, you are irritating it. One of the things that catches so many people out, and I'll use the other model as well in a second to demonstrate this, is they get tailbone pain. Some of those people think it's coccyx pain when they're sitting down, and they think I'm sat on my coccyx, so I need some funny cushion to take pressure off. And it's like, no. When you're sitting down, I mean, I can do it here actually. Okay, those of you on YouTube won't be able to see this, but those of you on TikTok can. When you sit down, you are not sat on the coccyx. The coccyx is floating in space. If you sit particularly badly, you might be sat on the coccyx, and then, goodness gracious me, what are you doing to your poor L5-S1 disc? You're sitting incorrectly. So assuming you're sitting correctly on the sitting bones, your tailbone won't be touching the floor. But what will be under more strain is going to be that L5-S1 in particular, and L4-5 section of the spine. And so you're putting strain on a tissue. Why does your broken leg hurt when you stand on it, when it's broken? Because it's damaged. Or when you put more load through damaged tissues, such as the injuries to your lumbar spine, your lower lumbar spine, they're going to give the pain distributions that you're experiencing. A lot of people do experience that tailbone pain where it kind of comes down here, even though the injury is up here where the green and orange join. Very, very normal, very, very common. And guys, those of you that are on YouTube, if you've got any questions, any comments, you can post that in the comment section as well. Just going through TikTok because you guys are always asking me lots of questions. So I'll keep rolling through these. What other questions have we got? Spicy Marmy also gets the pain in the coccyx. Probably from what I understand without even doing the leg straightening. When I stand, I get pain at the base of my spine. Any advice, please? So some people have this experience, and I was going to do the starting chat on this, but I decided against it, but I guess we'll do it now anyway. Some people have the experience of when they sit down, their sciatic pain goes. They find it relieving, and this is a bad circumstance to be in. The primary reason that it feels nice when you sit down is because as you sit down and you flex the lumbar spine, you open out these little holes where the nerves come out, and that creates less pressure. When you then go to stand back up again and you restore the neutral to the lumbar spine, the holes go back to their normal size. So what happens is the person's like super comfortable, sat slouched terribly, right? And then they go to get up, and as they go, sometimes it's a case of as they go forwards, the compression through the spine now creates the back pain. So that could be one scenario, but often that's not it. As they go to straighten up and the spine starts to go into its extended position, and by extended, I should perhaps more accurately say into its neutral position, the person then experiences pain. Why? Because those holes that were this big are now going back to their normal size. I want to stress here, their normal size. And just bear with me one moment, guys. I'm just going to slightly change the intensity on this camera because it is just so bright for those of you guys on YouTube. Hopefully this helped. It's fine on TikTok, but on YouTube it's just too much. There we go. That's better. Turn you away over there somewhere. There we are. So as we straighten back up, the hole goes back to its normal size. I want to stress this concept of extension of the lumbar spine is really misunderstood for a lot of people, right? The lumbar spine should have a neutral position like so. This is a neutral position. Note that relative to a straight line, this is extended, but this is neutral for the lumbar spine. Therefore, we should refer to this as neutral. It is a lordotic posture. If we increase the lordosis, we are moving into extension relative to the neutral. And if we decrease the lordosis, we are moving into flexion relative to the neutral. This is not technically even flexed, right? Flexed would be actually bending forwards, and I don't want to break the spine, so I won't do that. But the idea is that we go from the neutral. So when the spine is in its neutral position, the holes are a certain size. When we extend, which is a perfectly normal position to be in for people, but if you've got a back pain, it might, or back injury, it might be problematic. You make those holes a little bit smaller. And when you flex, you make them a lot harder, a lot larger, sorry. And so the spine is designed to be able to take up all of those movements. When I bend backwards or when I look up, I don't all of a sudden get raging nerve pain down all of my joints because the spine is designed to be able to move in those directions. But when we have an injury, there is inflammation in those holes. And then when we do bend to stand up straight into the neutral position, not extended, but neutral, relative extension from the flexed or seated position, we then can sometimes get that discomfort. And again, worrying about the fact that it hurts that you stand up, you're not going to do anything about that specifically. What you're going to do is rehabilitate your spine so that your spine is more healthy. Learn how to sit in a bit more of a spine-friendly way. Learn how to get up in a bit more of a spine-friendly way, thinking and prioritizing this, and you'll find that getting up no longer hurts. You can get almost instant changes, and we have it many, many times here where people will come into the clinic and they'll say, God, my back hurts so much when I stand up. My sciatica rages when I stand up. And then you see them standing up and they're like, oh gosh, it's so painful. And then you go, okay, well, let's not do that because that's not clever. Let's get ourselves over the edge of the desk. Let's get ourselves like so, get the heels, the feet underneath the bum, and then let's go, hold on to our legs, and then let's come up like so. Oh gosh, that didn't hurt. Well, we didn't fix anything. We didn't change anything. We just gave the spine a little bit more support and a little less vulnerability in the process of actually going through the standing up position. And so that's something that we really want to get right. And you learn to do that through obviously education and through practice, and that's how we get better. What other questions we got here? God, there's a lot of you guys on TikTok today. Awesome. The core 5 routine, is it enough once a day and then each exercise is enough to do 10 times. So core 5 is a series of exercises. That's the dead bug, the marching bridge, the squat, the hip hinge, and the step up. In the program, we've added in the single leg hip hinge. And the idea about these exercises is that they are the best. If you had to pick 5 exercises or 6 exercises, these would cover everything for rebuilding spine integrity, health, strength, and resilience for the long term. And they're appropriate for anyone with a bad back, right? And you might be thinking, mate, the single leg hip hinge, that sounds tremendous. Or the step up, that sounds terrible. I couldn't do that. I've got a really bad back. Like, understand that one of the reasons that they're chosen is because they are scalable to all individuals. So if you struggle, you know, you're in a lot of pain, you're thinking you've got a lot of disability associated with your back injury, right? Well, a single leg hip hinge starts like that, right? Now tell me you can't do that whilst being dressed, because you got dressed this morning and you'll get undressed tonight. And the movements that you're going to do with your body are way more strenuous than literally standing here holding, going like that. Or in the case of the step up, holding onto something and doing like that, learning, but you're not doing it asleep. You're doing it with purpose, with intent. I went to a really cool strength training seminar this weekend, and we were talking about, there was a phrase, and I'm going to probably butcher it, because he said he was going to butcher it, as Sean McKinroy, he said he was going to butcher it. I'm probably going to do the same. He said, when it's light, make it slow, so when it's heavy, it feels light, or something to that effect, which I did then go and butcher it. But the point is, when you're practicing these in the early stages of your recovery, your rehabilitation, you should be doing it with purpose. That looked easy. I could do it completely passively with no thought, attention, focus, engagement of anything, or I could do it with real poise, really focusing and thinking and feeling about how I'm doing it. And that's why we have tutorials out there to help you guys do this effectively. And it's really, really important that you do a skill level appropriate version of these exercises so that you can get into the process of starting rehabilitation. They're appropriate for absolutely everybody. They're accessible to absolutely everybody. And how you'd start off doing those is you might take the individual exercises and play around with them to find what you can do. Everyone talks about, I can't do that for my back, I can't do that for my back. No. Focus on what type you can do. You might not be able to do a full squat with 60 kilos on the bar, but you might be able to do a squat holding onto your partner's hands halfway down, right? It's spending the time to figure that out. And if we can't be bothered to do that, do we really want to get better, right? And if we're not recording ourselves, do we really want to be precise? And if we're not reflecting on those things, are we really taking this seriously? And like, ask yourself this question. If you've been struggling with lower back pain, when was the last time this week that you recorded yourself doing your exercises? If you've been struggling with one of the exercises, when was the last time you recorded yourself, watched it back, made some comments, some notes? A lot of times the answer is, I haven't ever done that. Well, why are we not? Every one of you guys on TikTok, on YouTube, you're probably watching me on the phone of some description, which means you've got the facility to take the video, to reflect on these things. We should be doing that. As bad as painful as the pain might be right now, we should be doing that. So at that stage, going back to the question, we're going to be doing it multiple times a day, perhaps. And we talk about this in the program. But as you go through the program, as you go through the process of rebuilding strength of your rehabilitation, what we call phases 1, 2, 3, and 4, you will start to do those exercises in a different way. You will combine them into a routine. You will do that routine one time a day. You will do it at an intensity that is appropriate for your current level of difficulty, your current level of capability. And then that will change over time. And long term, when you're in what we call phase 4, you start to move from maybe we're not doing things daily, maybe we're doing them 3 or 4 times a week instead, because we have to work hard and we realize that recovery, that rest is when the changes take place, that the training, that the rehabilitation work is nothing more than the stimulation for the body to then respond to in the time that we are actually not training. So it does vary as we go through the process, but just doing 10 squats once a day is not rehab. That's not, right? Spending 15 to 20 minutes on the squat, watching some tutorial videos, doing a bit of practice, learning, trying a bit, recording yourself, that is rehab, right? And that's the start of rehab, and then you build up from there. We've got Rowana, sorry. Is it okay to go to the osteopath for therapy whilst I'm an osteopath? It'd be perfectly okay. But you've got to do the rehab work. You've got to do the rehab work. We have patients that come to the clinic, and the proviso is, nowadays anyway, be much more forceful with this than in years gone by. You're not coming to the clinic if you're not doing rehab. There's no point. There's no point. You're wasting your money, quite frankly. Now, while there might be cases where actually there's some value in that and you get some intrinsic value, going on that decompression table in the other room or in the laser in the other room, and then you finish the treatment and you go back down to pick your bag up. Oh, thank you, it was lovely to meet you. And you walk out to the front door and you round your back and you get in the car seat and we sit back down like so, and then we drive home in this sort of position. That undoes any good that we could have done here in the treatment facility. You know, I'm being a little bit over exaggerating, but the point remains. Do the rehab first, and then you can leverage treatments, whether it's an osteopath like myself, whether it's an osteopath that's doing a more, you know, hands-on stuff. They're not using technology the way in which we do. It's a little bit more of a investment, let's say, to get this kind of gear to help people. But you know, if you're going to see your chiropractor who's doing some manipulation, if you're going to see your physio, you're going to see your acupuncturist, your massage therapist, whoever it is, understand what role they play in the recovery process and make sure that you are not neglecting or using it as a replacement for rehabilitation. I don't know where the herniated disc cannot heal statement came from. I'm not sure about that. Or rather, sorry, I am sure about that, but I'm not sure about where that statement came from. Because it implies, I'm assuming that it was in response to something I said. Make no mistake, your body is healing every single day. Your body is trying to heal every single day. There are sets of circumstances that are unique to the lumbar spine in particular, or more pronounced in the lumbar spine, that make it more difficult, right? Because when you injure this, when you herniate this disc and you damage this annulus fibrosus and the surrounding ligaments that protect and stabilize this lumbar spine, you have a tissue that is constantly under strain every day, so it's more difficult. But make no mistake, it's trying to heal. It's laying down scar tissue. That scar tissue is going to be disorganized in the first instance around the areas of damage, of compromise, annular fissuring, annular tearing, etc. Disc bulge, herniation, whatever. And it's trying to go through a healing process. But those tissues are very, very slow. We see this, and this is why we always talk about it, is the surface wound, the graze on your knee, cut on your elbow. You can see the process taking place there in the back. It's very abstract, which is why we need the education to start to think about it in this way. And understand that you can knock the scab off your knee graze, and all of a sudden it starts bleeding again. It's the same in the lower back. It's only the difference is that the tissues will recover and rebound from that flare-up a little bit more slowly, or a lot more slowly. And they're going through that healing and regeneration process an awful lot more slowly. But they can stabilize, and you can prove this to yourself by progressing through your rehab work. Building strength and resilience, starting off over here with a 5 kilo, doing your goblet squats, right? And then a few weeks later, maybe not a few weeks, right? But maybe a few months later, you've got the 80 pounder and you're doing some low hold squats. Make no mistake, 5 kilos was going through my lumbar spine, the injured one, the herniated one. And now 80 pounds is going through the injured lumbar spine. Quite clearly, its load tolerance has improved. Why? Because its structural integrity has improved. Your disc has healed. Does it look brand new? Probably not, depending on the scale of severity. But can it be functionally just as good as it ever could be? More or less. None of you, we discussed this on a dedicated episode of the podcast about the theoretical limitations of your disc once it has been herniated. But the mere mortals among us, of which most of us fall in that category, we're never going to reach the upper limits of what's possible in our injured disc after it's recovered. So it's basically disregard any limitations. It really gets people down up here when they get told by their osteopath or physio or chiropractor or spinal surgeon, they say, John, this herniated disc is never going to be the same again. And they assume that means they have to be like this right now. But that's not the case. It's never going to have the potential to adapt the same way in which it did when you were born. But you haven't been anywhere close to what was possible in that L5-S1 disc by the way in which you've led your life. You haven't devoted endless hours to developing its capacity for dealing with load. The most you've lifted is like a 45 kilo weight once. And so the limitations that it now has, being a herniated disc that's recovering, you're never going to reach those limits. So don't let them make you feel like I'm never going to be well again. There are too many people doing too many crazy things after having significant injuries. It's just a case of you need the right vehicle and the right strategy. And it's simple, it's not complicated, to rebuild the health and strength of the spine. And you need to know that's what you've got to do in the first instance. If you think that you're going to get into some funny position and your sciatica is going to go away in 3 minutes while you're in your living room, that's not going to happen, right? Those are the quirky stuff that you see on Instagram that's cool and fun, but it's not actually helping you rebuild strength, health, and stability. And make no mistake, like if you started the evaluation, for example, you see a lot of this stuff, right? So-and-so's like, oh, I'm stuck here, and then they finish the evaluation and they're going like that. Please note, no healing took place in the course of that time. All we've done is game around with certain things and stiffnesses. We haven't built anything in that process. Showing that kind of before and after in 60 minutes is just proving we're really good at making some funny hacks that allow the person to do some things. And those things might not necessarily be ideal. They might not. It's something to think about. The real demonstration of results is I remember listening to, I think it was Warren Buffett, talking about this, or it was a quote of his. I didn't hear him say it directly. He said, it's like, what do we want, results? He was talking about financial, having financial success. And it was like, we want very slow levels of increase of compound interest over a very long period of time, right? Because the change in you that you're looking for to heal this thing, it's taking place over months. So, but we want to see a before and after of, I saw a great one on social media. It was an older guy, I think he was in his 80s, and he starts off, he's doing a squat, and then it shows 1 year later, and his first squat is wobbly and it's all over the place and he can't go down that low. And then a year later, he's there. Some of you guys might have seen it because it went quite viral, and he's using like 50, 60 pounds, maybe even more. It might have been kilos, I forget. And he's there banging out these solid squats over a year. So you know that the changes that he's made within his body are real changes. They're not quirky gimmicks. They're not psychological tricks or funny little quirks making use of reflexes. There's real changes. Those are the kind of things that you want to see as transformations. Rick Dude has said, don't bend the spine, bend at the waist. No, that's incorrect, because the waist is the spine. And that, I'm sorry to be pedantic there, but it's worthwhile saying. This is the waist, right? My hip bones here, it's not the hip bones, it's the innominate, always a mouthful. That's here. Bending at the waist would be this. That is bending at the spine. You bend at the hips, right? And very, very important. Okay, so like for example, only because it's relevant to me because of the stage of life that we're in with the little ones, right? You think about the parent that has to put their child down every night for sleep, and they put them in the cot, and they go over to the cot and they went round over and put them down, and they're basically bending at the waist, right? Because they can't bend at the hips because their hips are lower than the side of the cot. So we bend at the hips, and technically speaking, what might be better is we flex at the hips, or we hinge at the hips with a neutral spine. So our hips stay like this and we hinge. That's how we do it. If we're bending at the waist is here, right in the middle of the lumbar spine, which we do not want to do. So good question there, or comment there. It's important to get this right. Daniel said, can rehab work lead to muscle spasms in the middle? Because I have scoliosis, and notice my middle back is often very stiff. Daniel, when you are starting, and for everybody, when you start doing proper spine stability work, you are engendering support for the lumbar spine that is invariably far, wide, and reaching, right? When we do a squat, when we do a hip hinge, when I'm holding the load here in my hands, as I go to this position here, you better believe there's some tension and activation in my middle and upper back muscles. I'm working those areas. When I'm standing correct, with my chest out in a good upright position, I'm activating those muscles, and most often is the case that those muscles are actually very weak. They're not very strong. If we superimpose a scoliosis on top of that, that might well have always been there, or most likely has always been there, it's not unreasonable to go through this period of stiffness, tension, fatigue in this region, far above and away from the lumbar spine. But that's just the process of those muscles getting stronger and stronger and more conditioned, and they're being challenged a little bit much at the moment. So Daniel, thank you for the question. That's something that you'll adapt to over time. So you've got to dial your training appropriately, right? And you can always march. You can only ever march at the speed of the slowest soldier. So some of you guys will have middle back weakness. Some of you guys will have a knee issue that's niggling. Some of you guys will have an ankle problem or a hip problem that goes alongside the lumbar spine issue. And when you're doing your rehabilitation, necessarily those areas will start to flag up at different times in the recovery process. And you'll need to slow down your progress to accommodate that area and then push on again. Most of us that have weaknesses in one area, unless we've explicitly built good strength, we often have weaknesses in other areas as well. And so often when we start the rehab, new members coming through the program, they're like, oh, by the way, my knee's a problem and my hip's a problem. And it's like, well, yeah, of course, because the muscles and the structures that we're strengthening to deal with the lower back are also the same structures that are going to support the hips and the knees and keep those healthy. Why do we think we have so many problems with knees and hips as well in society? Broken James said, how fix herniated disc? NHS is trash. I mean, yeah, the system that we've currently got here in the UK is not ideal. It really isn't. It's not optimal by any stretch of the imagination. I remember reading something about surgeons aiming to see their patients or consult with them for the first time by 18 weeks. And it's like someone who had, as soon as you get into the chronic stage of lower back pain, you have all sorts of other issues. So you want to try and avoid people getting chronic because there's other complications that are annoying and interfere with the recovery process, giving you false feedback and that kind of stuff. And so you just want to avoid people getting chronic, but the NHS's target, and I could be slightly off here. I remember we referenced it in a specific piece more accurately. But I know it was 18 weeks. I forget exactly the time, the exact criteria. But the target essentially was almost 50% longer than it becoming chronic, and that's not an appropriate target. There's just not the facilities to help people. And I think here in the UK anyway, like you need to go private. I know we pay our taxes. I know we pay for all that stuff, and I know we should be able to just call up and go to the GP. But at the end of the day, your health is more important than waiting 6 months, a year, many of you guys 18 months longer to have the kind of support that you actually need. And so you've got to just, there's a cost of waiting and there's a cost of getting it done today. And often the cost of waiting for the help through that avenue is often much greater if you really add it up in terms of days off work, in terms of all those other sorts of things. How do we find a neutral spine? Assume, this is a good one. Assume when you stand up, you are a normal human being, right? Because you probably are, unless you've got evidence to suggest to the contrary. So when you stand up in a normal position, you probably have a neutral spine, right? That's it. Now, comments about anterior pelvic tilt and all that kind of rubbish, you need to disregard those too much, right? Because what's actually happening in the spine and what's observable from the surface, there's all sorts of illusions that can be at play that make it look like you have one thing when you actually don't. And anterior pelvic tilt is a big one there. The best thing you can realistically do is stand against the wall. Your heels can be about an inch or so away from the wall, your bum touching the wall, your middle back touching the wall, and your head touching the wall. Engage everything nice, do a little chest pop, and that's it. Now, if you've got slightly larger glutes, your middle back might not necessarily touch the wall, depending on the individual from one to the other. But that's pretty much it. That's going to be the neutral spine. Your head over your rib cage, over your pelvis, over the ground. That simple. Don't worry about anything more. Don't worry about any tilts, any of this, that, the other. Assume in that position you have a neutral spine unless you have evidence to suggest to the contrary. One of the things that we used to do for years is X-ray analysis. That's where a lot of this insight has come from. Every patient, of the thousands of patients, this is before the program, the thousands of patients that came through the door would always have load-bearing imaging that we could see to match up to their postural representation. This is where a lot of the experience is lacking for a lot of individuals, which is why the advice isn't there and why people are talking about stuff that they can't talk about, because they haven't had the humbling experience of realizing, actually, do you know what? Although at university it's drummed into you when you're studying to become an osteopath, your postural exam. It's great. We can see how much the elbow bends. That's great. We can see the hip, the knee, the ankle, and all that kind of stuff. The spine, you don't have a clue. And the problem is you're led to believe at university, and I'm assuming it's the same for physios, and I'm almost certain it's the same for chiros, that you have this really good insight. But nowadays, especially, I was speaking to a couple of chiros recently, more newer graduates, and they were talking about this real shift away from using any kind of imaging. And that's a real problem because you're missing out. This new generation and swathe of chiros have no real fundamental foundation in the actual spinal anatomy and spinal structure in this kind of way, which maybe they did in the past. And so having that experience and being able to marry up a patient with a back injury and what their x-rays look like, their images look like, measured, not just going, oh, it looks like it's too much, right? Actually with numbers, and we do this for our members on the program, right? Regularly in the live sessions, we'll have members which will have posted their lumbar x-rays standing, and we'll do analysis. Some of them are lucky enough to have things like flexion extension views and that kind of stuff, and we can talk about things. And so, and you having that insight from an experiential point of view of seeing so many patients over the years, like assume that you are normal. That's the most important thing, because assuming you have some kind of anterior pelvic tilt because your physio said your tummy sticks out and your bum's sticking out is incorrect. It's incorrect most of the time, and you'll end up doing things that are actually going to make you worse, trying to fix a pelvic tilt that you don't have. Any tips on exercise to reduce pain that actually helps? Sorry, I just joined. A couple of things. I'm assuming it's back pain that we're struggling with. Guys, we talk about three things. There's relief work. Relief work is stuff like the towel decompression. It's stuff like the bed decompression. Using sensible hamstring, glute, and hip flexor stretching to mobilize the hips, but noticing that these are stretches of the hip joint that do not involve the lumbar spine. When people do a hamstring stretch, they invariably do that, rounding the lower back, negating any benefit they're going to get. When people do a glute stretch, they regularly do that, again, rounding and twisting the lumbar spine. When people do a hip flexor stretch, they will regularly do that and arch the back, and terribly. And they go, oh, it hurts. It shouldn't hurt if you're just stretching the hip joint. If you're not stretching the hip joint and you're actually just involving the lumbar spine, then it often creates trouble. So understanding that, and in there lies in the education component, which is component number 2 or component number 3, depending on which way you're adding this up. You need to have education. Otherwise, you're just going to keep making yourself worse. That's the big problem with lower back pain. People are continually doing things, bending, twisting. They don't even know that they shouldn't be doing those things in the early stages of recovery. And I'm not saying the spine is meant to bend. You'll see me all the time when I'm doing these videos. I just did, and I didn't have raging sciatica. The spine is, but yours is injured. So you need to not do that. And then when you get better, you will be able to do that again, as is required. And then we need our rehab work. Our rehab work is the stuff that actually gets us better. Those are the exercises like the dead bug, marching bridge, squat, hip hinge, and step up. And I suppose this is a good point to say, guys, any of you that have been struggling with lower back pain, with sciatica, etc., if you need more help and you want a structured program that has education, that has relief work, that has routines, tutorials, guidance, troubleshooting, strategy, live workouts, and has support along the process, check out the link in the profile page. On YouTube, check out the link in the comments. Follow the program. You'll be able to watch videos there that explain a bit more about the program before you sign up if you're interested. And that will help you. That will give you the structure that you need to do. And there are plenty of resources as well that are all freely available on the website. But the program makes it done for you. There's no need to muddle through it on your own. Question over on YouTube. I've got to remind myself all the time the pain I feel down in my calf and foot is sciatica. If you could choose only 3 exercises to do for your bulging discs, which one would it be? I think I would do, if I could only do 3 exercises, if I could only do 3 things, the squat would definitely be one. The towel decompression and contrast bathing. Why those 3? The squat is a technical movement that has wide-reaching implications in terms of the technique making you safer in everything you're doing. The squat is also a whole body movement. The squat is also infinitely scalable, meaning that you can scale it down to the point where you're holding onto your partner's hands, and you can scale it up to the point where you are lifting inordinate amounts of weight. So it's relevant at the whole way through the rehab approach. The squat can also be used itself to improve your flexibility at the level of the hips if done carefully later on in the process. The towel decompression, because there's no other way to restore and support the neutral spine, that you can do regularly, multiple times a day, as a mechanism for unloading and restoring and setting that natural normal position. The towel is under here, by the way. And the contrast bathing is, I suppose, an invaluable tool for even the most sensitive, especially the most sensitive, to provide some mechanism to calm down the inflammation in this lower back, to manage the accumulation of inflammation, not information, that happens in these little spaces. And so that would probably be the three exercises or practices I choose. But the good news is, Hanzo, you don't need to just choose 3. And if you do a more robust approach, then I would suggest that would be the optimal approach. But that's me off the cuff answering a question that unfortunately, I'm not a big fan of that, because the thing is, guys, like when people are looking for a single exercise or this, that, the other, like there is no best one, right? I mean, there kind of is, because I just mentioned it, but you know, there are little bits that's missing, right? That's missing an element of lateral stability, right? That a step up or a single leg hip hinge would bring in, right? It's not off weight bearing, so you can't play around with things in the off weight bearing environment like a dead bug and marching bridge can, you know? Because some people really struggle with the standing position, so it means they can do some extra stuff. They can do their squats while they've got tolerance, and then they can do some extra stuff lying down in bed, you know? So there's other bits and pieces to that, which is why you have a program, not just 3 exercises, because quite frankly, 3 exercises aren't going to fix everything. Although you can make a good bit of progress with, you know, 4 or 5 exercises, like for example, the core 5, because they really are working each of the individual areas, but there's no relief-based component, right? One of the traps that some of you guys have got into that just try and do the core 5 on their own is that you haven't got anything relief-based work. There's no relief-based work there, so you're missing something that can make the process a little bit easier, right? The relief work isn't making you better, but the relief work makes the process of doing the core 5, the rehab, a little bit easier. I do think fundamentally the core 5 or core 6 now, as they are like literally you don't need to do anything else apart from those in terms of rehab work. The dead bug, marching bridge, squat, hip hinge, step up, and single leg hip hinge. Like that is really robust. I don't think there's anything else. And there's been a lot of thinking and a lot of work that's gone into thinking about these kind of things over the last years. You know, hundreds of consultation calls with members, with new members that have come through the program. Obviously, all the many thousands of comments that we've done from members inside the members area to come up with that kind of process, right? So I do think those exercises are the simplified version, right? That they are very or not simplified to make it sound like you don't need, it's missing something, but they are really the condensed essence of what you need to get better from back pain. But they are missing out on the relief-based work, which, you know, doing some of that relief-based work, that's why we have a relief routine that's freely available on the website. So you can pair that up yourself. But if you want more help and support and structure to do this thing with all the extra bits, you know, of advice and guidance and support along the process, then there's the program there as well. Hanzo said, the reason I asked is because it's for my senior dad, looking for the most effective exercises to help him progress. Yeah, I think, you know, the core 5, I don't think it would be beyond him. It might be that you build, I mean, okay, let me say very clearly. We have members of the program that are in their late teen years, early 20s. We also have members of the program that are in their 70s, 80s, and 90s. So there's people of all ages that are working through the program. So, you know, you might want to drip feed them in and get them to work on them a little bit more carefully over the course of time, Hanzo. You know, maybe where the average person might learn those essential exercises over the course of a week, he might spend maybe a fortnight or so, and he would be accepting of that because, you know, with age comes patience and wisdom. Yeah, hopefully that makes sense. You know, sometimes actually the younger people find it more difficult because they don't have the patience to learn these things properly. Thanks for the comment. You put me on the spot, but hopefully I'm glad the answer was well received. Finny Hizzy has said, my doc said significant scoliosis to the right at my L3 is normal. Not really sure on that comment, to be completely honest, whether it's associated with back pain or anything like that. It is perfectly reasonable to have a deviation one side or the other in the presence of scoliosis, and I don't think scoliosis is a diagnosis of a back injury or of a reason for pain. It can be part of the embellished description of what's going on down there. We've got an L5-S1 disc herniation, and we have the presence of a scoliosis, and the herniation is on the left-hand side, and the symptoms are down the right-hand side, or whatever it may be. You know, I'm using examples here. The scoliosis might be a part of the narrative around your back injury, but the scoliosis is not really the most important thing by any stretch of the imagination, in the way in which it's just kind of, that's the only line that we've got there. What have I got here? Habibah has said, when I stand and walk for something, like doing the groceries, I get pain at the base of my spine after that because you've got a back injury. Why could this be so? Any advice? Because you've got a back injury and you're putting load through that spine and you're carrying the groceries, that's extra load. You know, you've got to do your rehab work, strengthening work. It's through your strengthening work that those kind of things get better, get more tolerable, get easier, stop causing you pain. What are the questions, comments? I know I've missed a couple here. Oh, is that, you've posted on YouTube as well? Huh, that's cool. I'm worried about my back pain becoming chronic. Meg, then you've got to do the rehab work and the relief work. Check out the link in the profile page. Don't worry about it. I mean, worry about it if it motivates you to do something about it, but don't worry about it. You know, you'll be fine. You just got to do the work. And you've got to, you know, feel confident that you're doing the work, which is why education is so important. Hanzo said, towel decompression is laying on your back with the towel underneath your lumbar region for some time. We generally suggest doing it, Hanzo, for around about 3 to 5 minutes. Now, it might be that you only do it for, 30 seconds to start with. You might need to play around with the size of the towel. You might need to play around doing it on the bed instead of doing it on the floor because, Hanzo, was it Dad? Yeah, Dad. Dad might be struggling right now to get on the floor. So there are all these considerations, right? The dead bug, for example, as part of the core 5, that's an exercise which requires you to get on the floor. If getting on the floor is a problem because you lack the competence to do it effectively, do it on the bed. It's not as good, but it's not worth you aggravating your back and then lying on the floor and going, oh, my back hurts when I do the dead bug, when it's actually not the dead bug, it's lying on the floor hurt you because you can't get down on the floor without doing like some sort of like weird, like, oh gosh, no, and then I'm like, boom, I'm down on the floor. And then I've got to get up again and I can't do this without pain, right? Of course you can't do this because you've got a bad back. So maybe getting on the floor is actually not going to be appropriate for you in the early stages of recovery. Something to think about, for each individual. All the stretches make me feel more pain. Looking at how you're doing them is really, really important. As I said earlier, hamstring stretch, glute stretch, hip flexor stretch. Many people have done those before. Probably all of you guys watching this have done these kind of stretches before. But how you do them makes a difference. If you're experiencing pain, you've done them wrong because you've used your spine when you shouldn't have bent your spine. What other comments have we got here? I think so we've got something coming on YouTube as well. I have sciatica since last September, so we're coming up over a year now. 11mm herniated disc, improved with exercise, but should I still? I'm not sure what the last part of that question is, Amjam, it's cut off. But if you're still struggling, the most important thing you can do, I'm going to assume maybe the last part of that question for Amjam. I'll just see if he's posted it down here. No, I can't see. Your rehab turns into strengthening. And I mean, fundamentally, it's the same thing, right? It's just called a different thing because it sounds less scary. If we said strength training for your herniated disc, you'd be like, no, we're not doing that. But that's what rehab is, right? And if you're being careful with your strength training starts with establishing correct technique with a very, very safe load, probably no load, by the way. And so that's an important consideration. But you have to continue building it, right? A lot of times, if not all of the time, your rehab will need to continue far beyond you feeling better. And a lot of people get caught in the significant trap of their back is able to patch itself up again. The herniated disc is able to patch itself up again and create a degree of stability that allows the person to get through daily life without creating significant aggravation. So they're like, cool, I'm happy. And so they don't do the rehab. So they never really build any objective resilience back into the lumbar spine. So then you re-injure a weak back later on. Any of you that have re-injured your back from picking up a water bottle or putting your socks on, you didn't build a strong back. And so you've got to continue the rehabilitation process and make objective targets. We talk a lot with members about this in the phase 4 of the program. It's about rebuilding objective strength and load tolerance into the lumbar spine. So not only do you feel better, but you know you actually have improved load tolerance. The structures that have been injured and failed have objectively reached a certain level of strength and resilience. Can you give some examples of foot drop rehab? Actually focus on the back injury and see how things go with the foot drop. It's often one of those things that changes very, very slowly. If you think about the concept of foot drop, right, what we're saying is that the foot is stuck down like so. We can't pick it up, so we keep tripping over it, right? The tibialis anterior is one of the muscles that does that. So maybe we're suggesting that we've got some nerve damage that occurred as a result of our herniated disc. And so this muscle down here has weakened, right? This muscle is working against the calves. They are like the strongest and most mechanically efficient muscles in your body. And so even let's just suppose that the nerve heals, you've still got tons of hypertrophy training to do on this muscle for this to actually get to the point where it's strong enough. So what I'm saying there is, I'm assuming you're doing the proper rehabilitation work for your back. Prioritize that over time. Sure, you can do some tib-ant work. So tibialis anterior work, basically pointing your toes towards your nose with varying degrees of resistance and load over time. But focus on getting the back better and observe what happens to the foot drop over an extended period of time. If we've had any nerve damage that has resulted in the foot drop, peripheral nerves do heal, but they heal even slower than discs. So you're better off focusing on the lumbar spine, focusing on that rehab and observing how the foot drop changes over time, observing your strength and power there. Because even when the nerve, if it's going to heal and it is healing, even when it is healed, there's still a massive disparity in the strength of the muscles that dorsiflex the foot, lift the foot up, so stop the foot drop, versus the calf, which will need to be overcome over a period of time. And again, that's going to take time. Bear in mind, muscles respond to strain in weeks of the appropriate strain, and ligaments and other tissues in months. So we're thinking about the discs there in the spine, and then your nerves, they're going to be slower. What else have we got here? YouTube, great tips. There is no way my dad will get on the floor. Yeah, get him doing, that's the nice thing about, I would argue the best parts of the core 5 is that they're standing, right? So you can do them standing, and then do the other ones on the bed. Because I'm assuming he lies down in bed. Derek has said, when walking and symptoms start, which relief action would you recommend? I stand with my hands on my knees and straighten my back. It seems to help. Often people do things like they're walking along, their back pain builds up or the sciatica builds up, and then they squat down like so. Oh yeah, stretch, and then they can go again. Or like this, oh, and then they can go again. All you're doing there is you're walking, like you need to reduce the walking distance. Walking has a relief-based role, but you should not be walking to the point of aggravation to where you need to do some of these sorts of things. Focus more on the rehabilitation work, and you will notice that the walking distances before you feel the need to do those things increases. But really focus on the rehab work. That's more important, so much more important. And just think about, I'm not sure exactly what we're doing with regards to hands on my knees and straighten my back, but to me, that suggests we're either having to circumstantially be walking for longer durations than we'd like to. I hope that's temporary, but if it's daily, you need to figure out how you can change that as best as possible. What other questions have we got in here? How low can I bring my back in a hip hinge? I'm going to ask you, not me. How low can you bring your back in a hip hinge? I can bring my back this low, right? And I could definitely have room for improvement, right? That's a good hip hinge. My hamstrings have gone any further than I'm rounding my lower back. So that's me, right? My hamstrings need a bit of work. I did some hip hinges yesterday, and my hamstrings are pretty tight right now. You know, there's a little bit of DOMS in there. How low can you do it well is a question that only you can answer, and then over time you get better at it, right? Which will demonstrate that you've improved the range of motion. A nice, interesting one that I've seen maybe in the last couple of months is that, man, I'm not overrunning, am I? Good. Is that it was comparing stretching versus strengthening exercises for improving the mobility, specifically of the hamstrings. And I think they were looking at the hip hinge exercise specifically, or the Romanian deadlift. And they found that there's no difference. Both exercises can improve the range of motion at the level of the hamstrings, or flexibility of the hamstrings, or lengthening of the hamstrings. And actually, some people are probably going to find it easier and more efficient for time to use exercises like the hip hinge as a mechanism for improving the flexibility. But what's most important, know me, is that when you do this, you are actually maintaining impeccable form. And as long as you do that, happy days, you're going to be fine. Other questions in here. Alina has said, I've done your rehab exercises for about 3 weeks and it's so much better. Oh, that's cool. Awesome. Yesterday I made a bad move. I was in a hurry and my sciatica and back pain is now so much worse. What do I do? So Alina, I'm not sure if you're in the program, in the membership or not. If you are in the membership, definitely get in there in the group and give us some more details. That'd be super helpful. If you're not, I'm assuming you're probably doing the core 5 exercises. So you've got things like the back pain relief routine, which is a good one to do. Debrief. What did you do wrong? You know, have a think about it. Where did I go wrong specifically? Did I do something? Did I move in a certain way, etc., etc., etc.? To try and avoid that mistake again. But also know that, you know, these things happen. More or less everyone's going to have relapses along the way. The important thing is that we learn from them. Ideally, they would happen as a result of you pushing yourself too hard in the exercises. But often, as I suspect is in this case for Alina, it's something else, right? We're doing something else over here, and we just did the wrong thing, and now all of a sudden we've got a bad back again. We've let ourselves up. But the good news is you've learned, you've made skill improvements in these exercises, and so the recovery from this relapse, you leverage things like contrast bathing, you do the towel decompression, bed decompression, so maybe some massage gun. You're going to do other bits and pieces like those that we talk about in the relief-based work for the program, like those in the back pain relief routine, which is a free video on the YouTube channel, which is modeled on one of the routines that we have for members in the program. You leverage those kind of things regularly. I would really suggest contrast bathing is a great one because much of the symptoms that you get after a flare-up are actually accumulation of inflammation in this little area where the nerves come out. And managing that inflammation with something like contrast bathing is actually really, really effective. I'm just looking, I think I took it upstairs. But the Therabody do their little cube, which is a great tool for contrast bathing in an efficient way. Naomi has said, I can bring my back full low. So is this good? I don't know what you mean by full low. One of the things that we always get members to do in the program is upload videos of exercises like the hip hinges and the squats so we can review them, see exactly what you're doing and give you guys feedback so that you can get it right and make sure and validate that you are doing it right. And then it's great. You've got a great full range of motion hip hinge. It looks too easy. Let's start working harder. Because remember, the way in which your rehab works is kind of in like 3 parts. The first part is getting technical proficiency. So you need to be technically sound, and that will improve over time because you will obviously get more and more skilled at this exercise, especially if you're doing it conscientiously. The second part is actually finding the right difficulty. So now you've got a good technique, you want to pressure test that thing to figure out where do you get to the point where actually I can't do too much more, right? And that's where you want to be to then get change to take place to actually get the strengthening outcome of both the muscles. And then long term, the third one is in the discs as well. As you steadily start to be able to safely apply load to the spine through movements like the hip hinge and the squat, you will literally strengthen up the spine itself. Again, it's worth repeating for those of you that didn't join from the start. If I today can only do a hip hinge with 5 kilos or a squat with 5 kilos, because 7.5 kilos is too much for me to do, my spine cannot bear it and my form will fail and break down. And then in 6 weeks or 6 months or 12 weeks time, I can do 10 reps of this, which is an 80-pound kettlebell or 36 kilos for those of you in the UK. Then I know for a fact I've got better, without a shadow of a doubt. And I've undergone some adaptive change in these discs. They are more tolerant to load and I can measure it and I can tell you precisely how much more. I haven't got to 100 pounds, but I'm at 80. And maybe 100 pounds maybe I've tested 90 pounds and it was too much. So I have this intimate understanding of how much my back can bear, and the all important question, how healed my back is. You've got Daisy. I had a partial discectomy. I now have degenerative disc, left-sided prolapse at 4-5. I'm assuming that's subsequent to the discectomy. Bed-bound options are decompression or fusion. I'm 20 years old and I play elite sport. I don't know what sport you do, Daisy, I'm afraid, and I'm sorry to hear that. That's tough. I think I would sincerely and seriously look at the rehab work. Depending on what sort of sports you do, if it's certain types of sports, there'll be a lot of bending and twisting involved in the lumbar spine. Relearning the movements that we talk about. It's no different for you than anybody else. If you've got aspirations to get back into sport at a high level, then you're going to need to do the basics like every other person that we talk about here. Learn spine stability work, rebuild and strengthen. Yes, there's going to be a lot of pain right now, but what that tells me is that the underlying reasons for this injury, or the things that stop this injury getting better without having the surgery in the first instance, have not been addressed through rehabilitation work. And we probably got back into bending and twisting stuff way too soon. Help things calm down with things like contrast bathing. Start learning movements like the dead bug, the marching bridge, the squat, the hip hinge, the step up, the single leg hip hinge, the stuff that we talk about in the program. And if you struggle with any of those things, that's amazing, because you've got something that you need to work on. In spite of being in a high level sport person, there's probably still room for improvement. And now you've got this acute awareness of where those improvements lie. There will be a point at which you're doing the dead bug, for example, or the squat or the hip hinge, that it becomes more painful, that we get aggravation. We talk about aggravation-free reps. And so at that point, explore what happened, what went wrong. And then we can start to learn. We've got nothing else to do right now, right? We may as well get working on this. And then as we make progress on the rehab front, then you start having discussions about getting back into the sport and the prospects of that and what's going to be necessary. And if you can catch up to your contemporaries that have been competing uninterrupted. I always remember a case, it wasn't an injury, but when I was younger, in my teenage years, I was doing a lot of swimming and swimming to a high standard. And one of the last years before university, I got glandular fever the summer, so it was lower 6, so I would have been 17. I got glandular fever. And people that I beat at the previous Southwest of England trials, people that I beat in those trials then went on. So I got glandular fever, couldn't train for a number of months. It was really frustrating because it actually wasn't that bad, but you're not allowed to train, or weren't at the time allowed to train for an extended period. So I had lots of time off training. And then when I did train, I trained as hard as I could. And someone that I beat on a 50-meter freestyle by a good margin smashed through the qualifying times for the nationals in that, and I just missed out by, it was fractions of a second. And that was an example where, you know, something that took me out for an extended period where I couldn't train meant that others were pushing on further. And the question you've got to have for yourself, which is an honest question, which is not something you want to hear when you're pushing at a sport at a reasonable level, is, you know, am I going to be able to catch up to that? Now, given more time, I probably could have, right? But I only had like 3 months to get back into training before the national qualifiers were. And so that just wasn't enough time to bridge up 3 months of not training while everybody else is still training. So yeah, a little bit of an annoying circumstance, but maybe not too dissimilar to something you're going to have to wrestle with, Daisy. I don't think there's any reason you have to have the surgery unless you've been told, you know, I'd be interested to know why those are the only options. Those might be the only other things left to do in that regard, but are they, that's very different saying that to saying you have emergency symptoms that need you to have surgery. And I think you probably wouldn't be posting on a YouTube video if it was an emergency surgery that was necessary in that scenario. So a couple of things, Daisy, I hope it's helpful. Zlak has said, I'm also constipated and have bulging discs in my neck and lumbar region. Could it be related to nerve irritation? So one of the big things with regards to constipation, and I can see that Hanzo said something about the gut here. One of the big things is when you guys are taking things like ibuprofen and other medications, there often are gut side effects, for example. Also, not moving can affect, like if you're just not moving all day because you're in pain and you don't want to move, that affects, I would argue, the degree of gut motility, right? Because there's something about moving around, being active, that helps that thing work. And if we go from normal levels of activity to nothing because we've got bad back, I would argue that that's going to create a degree of, let's say, dysbiosis, for example, in the gut. And so having constipation is not something you want with a bad back. Why? Because someone who's constipated and got a tummy ache does not sit up like this, does not stand like this. They're like this, holding their tummy. Now, what's that doing for the lower back if I'm like this all day? And then if I'm straining on the toilet like this, look at my back. Is it any wonder I'm struggling to get better from my herniated disc at L5S1 if I'm in those sorts of scenarios? So I don't think it's necessarily like related to the nerve irritation. The neck I would put aside, but certainly the lower back, in answer to Zach's question. When we have gut issues, they don't help people with herniated discs. It definitely makes things worse because of what you have to do. Naomi has said, ever since I started exercises you suggested, my pain had improved a lot in the first 15 days. When I started lifting weights, I'm now up to 25 kilo. It's not difficult at all. But after 1 to 2 hours, I experienced pain. Why is that? It can be a number of different things. Looking at technique is very important. We want to make sure we've got aggravation-free. That's really cool that we're making some progress, by the way. That's really nice. It could be as well, like when you're working out hard. So for example, my hamstrings are a bit tighter from my workout yesterday because I've started reintroducing more leg work slowly as I wanted to do in September after the knee injury. And so my legs aren't very strong, and a light workout actually challenges them to the point where I'm getting a bit of DOMS. So my hamstrings are a bit more stiff today, which means they pull my back round a little bit more when I'm sitting. And so it could be, Naomi, we finish doing our workout, then we go and sit in the office and doing a bunch of work on the computer, but my hamstrings and my legs are tight, so they're pulling on my back a little bit. That can be a factor. So we talk a lot with members about when you are doing your rehab work and you're scaling the difficulty of the exercises, and we start to run into the risk of getting things like DOMS, delayed onset muscle soreness. We have to manage the post-exercise reaction a little bit better. So something to think about there. That could be one of the factors. It could also be a number of other things, right? If you start lifting 25 kilos, as you've made progress on your rehab for your back, you think and feel that your back's doing better, right? And so you might be a little less careful with the other things you're doing outside of the workouts themselves. As Zach has said, any vitamins to speed up recovery, focus on the rehab and focus on a good healthy diet. I don't think there's anything beyond that. You know, we typically say the first supplement you might want to add in is protein, and then beyond that, you know, eat healthily is going to be the best approach I would suggest. What else have we got here? I'm just going to have a look through some of these comments. Guys, we've just crossed the hour mark on YouTube. So those of you that need any more help, any more support, that kind of stuff, I'll go through a couple more questions, but then we'll have to wrap it up. If you need more help and support, check out the link up here in the profile page. Those of you on YouTube, I'll post the link down in the chat. If you need more support, check out the program. There's a video on that page, backinshapeprogram.com/start. There's a video there that explains a little bit more about the program. Like if you guys need some more support and you've been struggling for a long period of time, whether you've had surgery, whether you haven't, whether you've had a long-standing disc injury or you're struggling with your rehab, check it out because it really will help you more. Just a couple ones I'll just try and finish up with just to help you guys. Had a CT scan MRI. All I got told was wear and tear on my spine, had no guidance, still stuffing. Sheena, that happens all the time, unfortunately. Get on with the rehab is all I can say. You know, wear and tear implies there is stuff going on there. They're making the assumption that it's not significant damage and therefore it's not associated with your current levels of pain. But it sounds very, very common in terms of that experience, unfortunately. The MRIs and the images, they are a really great tool in the presence of a great practitioner who wants to really help you. But all too often it's just like, yeah, there's nothing particularly crazy there, so, you know, off you go. And you can have very minor findings and still have them managed significantly badly to the point where you don't actually feel like you're getting better. Additionally, if we've got wear and tear in certain areas of the spine, often it's like, oh, we've got age-related wear and tear. It's like, yeah, but why is L4-5 and L5-S1 the ones that are worn, and why are these ones not? And there's reasons for that. And it's very reasonable that you've strained those segments that are worn and torn. If they're visible on the MRI, that means that we've had abuse going through that section of the back for an extended period and probably not the strengthening work, so we need to go through the rehab work. How many times a week should you do rehab work? You should be doing it daily to start with, but it does vary later on. L5-S1 disc pressing on the nerve, which causes pain into my calf. I can't walk. Hannah, you've got to focus on providing stability and protection for that herniated disc so it can go through the recovery process. Hanzo said, how do I know when to stop the exercises for today? You shouldn't be experiencing pain when you're doing the exercises. You should not. The exercises are invariably significantly less strenuous than everything else you're doing. We always work on aggravation-free with correct choreography. Just trying to do some quick fire answers here to just help as many people as possible, guys. Would you do low back holds be beneficial within the core 5? I think they're a waste of time. Just focus on reps and sets. It's much easier and much less variable in terms of like the quality. That's one of the reasons I don't like planks and things like that as much. I wouldn't recommend them. Would you recommend surgery for DDD? No. I would not do the rehab work. Make significant progress on the rehab work. And if you're saying I've tried physio before and it hasn't worked, what specifically have we been doing? Most people haven't been doing things correctly for an extended period of time because it's not the done thing, right? Most of the time it's go and do this sheet of exercises. That's not a program, by the way. Go and do this sheet of exercises. That's just a shopping list of exercises. It's not a rehab program. And so most people haven't actually done a rehab program in its proper form. So do that first for a significant period of time, sincerely, right? All of you guys that are still on, let me know how many of you have actually recorded yourself doing your exercises this last week on your smartphone, and how many of you watched it back and tried to make changes, then reevaluate with a recording. The answer is probably silence, right? Very few people actually do this, and if we haven't been doing things properly, right? Very important. Hanzo said I cannot exercise then because there is always a baseline of pain. That is wrong. That is very, very wrong. So I'm very glad you've said that Hanzo. Aggravation-free. If you're already in pain, you got up to go to the toilet. So if you're already in pain, but you got dressed in the morning, if you're already in pain, so you went downstairs, if you're already in pain, so you made a coffee, if you're already in pain, but you walked the cat or fed the dog, whatever it is, right? You're already doing things every day. None of those things have any upside for your back recovery, yet you're doing them anyway, which is why it's aggravation-free, not pain-free, right? You're willing to tolerate the pain to go and feed the cat. Why are you not willing to tolerate the pain and look for aggravations of that pain, increases of that baseline pain within the context of the exercises? You should not be getting increases in the aggravation. But feeding the cat is way worse than lying on your back doing a core engagement, lying on the bed. Feeding the cat is, or getting dressed in the morning, putting your underwear on, or putting on the dressing gown and going downstairs is way more strenuous with zero upside than holding onto your partner's hands and doing a gentle squat like so, right? Those things accumulate and they make the other stuff better. So there are certain people that are such a low level of stability and a significant level of pain where everything they do is pain. Fine, great. What you're currently doing is everything and none of it is helping you, yet you're putting up with the pain anyway. So do this set of things over here that are safer than those things that will actually make you get better, so they'll make everything else easier. But it doesn't happen on day one. It takes time. So you may as well do them anyway. That is one of the big rational points that really is so game changing for so many people. It's just, I'm gonna wait until I'm out of pain. It's like, no. Guys, hopefully that's helpful. I'll wrap it there. Thank you for Hanzo on that last question, because it's something that so many people ask. It's one of the reasons we've got a good couple of videos on when do I start exercise if I've got severe sciatica and that kind of stuff. Hopefully it's helpful, guys. If you need more help, support, I've overrun, but check out the profile, check out the YouTube channel, check out the website, and if you actually really just want the best, then go and check out the program, because that's what will help you. That's what we built it for. There's hundreds of videos there. There's instructions, structure, tutorials, troubleshooting, support, education. There's everything in there. And it's awesome. And we're in there too. So, yeah. Thanks for joining, guys. Have a great one.